Ever get the feeling the world's moving so fast you just can't keep up?
It's information overload out there.
That's where we come in.
Yeah.
Today's deep dive, we're tackling healthcare in Andhra Pradesh.
Fascinating place, lots to unpack.
We've got reports, articles, first-hand accounts, you name it.
Really gives you the full picture.
So no matter where you're starting from,
Even if you're a complete newbie.
you'll be up to speed in no time.
Absolutely.
But before we jump into the nitty-gritty,
Yeah.
I gotta ask, just for context.
Okay, sure.
India has that 3-tier healthcare system, right?
Yeah, right. You've got the primary,
Primary,
secondary,
secondary, and then tertiary care.
tertiary. Okay.
Yeah.
So, like your local clinic, then the district hospital, and then the big specialist centers.
Exactly. And it's supposed to be this, seamless flow.
In theory.
Yeah, in theory.
But Andhra Pradesh, they're doing things a little differently, right?
That's what makes it so interesting. They're not just focusing on one level. They're trying to boost all three. Okay, so how are they actually doing that? Because from what I've seen,
Yeah.
the government seems super involved, way more than I'm used to.
It's true, yeah. And one of their big moves is the Aarogyasri health insurance scheme.
Aarogyasri, okay.
This isn't just some pilot program. This is one of the largest state-run healthcare programs in all of India.
Wow, seriously.
And the scale of it is incredible. We're talking free medical care up to, 5 lakh
5 lakh, that's
per family
per family
every year.
every year.
And this covers both government and private hospitals.
Hold on, both.
Both.
So someone in a village can go to a fancy private hospital in the city.
That's the idea. They're trying to, level the playing field.
Ambitious, to say the least.
Yeah.
But how's it working in practice?
Well, that's where things get interesting, and that's what we'll dive into.
Okay, so stay tuned for that. Then there's this whole thing about Dr. YSR Village clinics, over 2,000 new clinics. That's got to be making a difference, right?
Here's the thing. Most states, they focus on those big hospitals and cities.
Makes sense.
You would think so. But Andhra Pradesh is going hyper-local with these village clinics.
Interesting.
They're staffed with doctors, nurses, basic diagnostics, the whole shebang.
Okay, so it's not just an empty building. It's actually, functioning.
Oh, absolutely. They're really trying to bring healthcare right to people's doorsteps.
Especially in areas where just getting to a hospital is a huge ordeal.
Exactly. And early data shows, a significant decrease in preventable deaths.
Wow, that's amazing.
Mothers are getting prenatal care. Kids are getting vaccinated.
Things that, we often take for granted.
Exactly.
Yeah.
But in those areas, it's literally life-changing.
And how does that compare to other states, like similar states that went the big hospital route?
Well, the research is still preliminary, but Andhra Pradesh's rural health indicators are improving faster.
So their approach is working.
The signs are definitely promising.
That's awesome to hear. But I have to ask, even with all these clinics popping up, what about those really remote areas? I mean, way up in the mountains, deep in the tribal region.
You're thinking about those places where even a village clinic is a day's journey away.
Exactly.
Well, that's where the Dr. YSR telemedicine program comes in.
Telemedicine, okay.
They're using technology to kind of leapfrog over those infrastructure hurdles.
So virtual consultations, remote monitoring, that kind of thing.
Exactly. It's not just about convenience. It's about reaching those who would otherwise have no access to care.
So they're covering all their bases, in-person clinics where possible, telemedicine where it's not. But it can't all be good news, right? There have to be some downsides to this approach.
You're absolutely right. No healthcare system is perfect.
Yeah.
And Andhra Pradesh is facing some pretty tough challenges.
All right, so let's dive into those. What are we talking about here?
Well, imagine you're in one of the bustling cities like Visakhapatnam, Vijayawada, Guntur.
Wow.
You see private hospitals everywhere,
Yeah.
state-of-the-art facilities.
Right.
But then you travel a few hundred kilometers to, say, Araku Valley.
Oh, wow.
Or deep into the Rayalaseema districts.
Yeah.
And it's like a completely different world.
So that rural-urban divide,
Exactly.
it's really stark in Andhra Pradesh.
Oh, absolutely. And it's not just about, fancy equipment.
Yeah.
The sources you shared,
Yeah.
they highlight this critical shortage of doctors and specialists.
Especially in those rural areas.
Exactly.
It's hard to attract talent when there are so many other...
Oh, yeah. I mean, think about it.
Yeah.
Would you rather live in a remote village?
With limited resources?
Right.
Or a city with, better opportunities?
Better pay.
Yeah, it's a tough choice.
Tough choice.
But what does that mean for the people who actually live in those villages?
Well, it means they might have to travel for hours,
Oh, wow.
even days,
Just to see a doctor.
just for a basic checkup.
Forget about specialists.
Yeah.
And sometimes those delays could be, well,
Life or death.
yeah, there was this one story that really got to me.
Oh.
In one of the articles, there was a woman who was in labor,
Oh, no.
and she had to travel over 8 hours
8 hours.
because the nearest clinic didn't have a qualified doctor.
Oh, that's just heartbreaking.
It is. It's like,
It's like they're trying so hard with these initiatives,
yeah.
but they're not reaching everyone equally.
And then on top of that,
Yeah.
you got the infrastructure issue.
Oh, right. Even with all the investment they're making.
Even with programs like Nadu Nedu.
Nadu.
Oh, sorry. It's this big initiative.
Okay,
They're basically overhauling schools and hospitals.
got it.
Renovations, new equipment, the works.
Sounds impressive.
But even with that, a lot of government hospitals still lack
Basic equipment.
basic stuff. I'm
Yeah.
talking x-ray machines,
Yeah.
enough ICU beds.
Really? So even if a patient manages to reach a hospital,
Exactly.
there's no guarantee they'll get the care they need.
It often means delayed diagnoses,
Oh, wow.
having to travel to another city, even for simple procedures.
And all that adds up. Oh, yeah. It's frustrating. It's time-consuming,
Expensive.
incredibly expensive, which brings us back to that reliance on private hospitals.
Right, because even with Aarogyasri,
It's still a huge financial burden.
people are going into debt.
And, it creates this tricky situation.
Yeah.
Private hospitals,
They're often better equipped,
they have the latest tech, the specialists.
but they're also businesses.
Exactly. They're driven by profits.
So there's this risk that Aarogyasri could actually lead to
Over-treatment.
unnecessary procedures,
Just to maximize those insurance claims.
like a double-edged sword.
It really is. It's like you want people to have good care,
Right, the best care possible,
but you don't want to create a system
where healthcare is just another way to make money.
and then layered on top of all this,
Oh gosh, there's more.
you have the disease burden in Andhra Pradesh.
Right, all the different illnesses they're dealing with,
Dengue, malaria,
the chronic conditions too, right?
diabetes, heart disease. It's a lot.
And wasn't there something about a high rate of kidney disease?
Yes. In the Udinam region.
That's right.
It's really serious, and it seems to be linked to, environmental factors.
Wow, imagine living in a region where kidney failure is so common.
It's devastating, the financial toll on families, the emotional stress.
It's a whole other layer of complexity.
It really highlights how interconnected this all is.
It's not just about building hospitals.
Or, having insurance.
It's about addressing those underlying causes.
The social determinants of health.
Exactly. And one of those key factors have to be public awareness.
Oh, absolutely. If people understand the risks,
How to prevent these diseases.
it could make such a huge difference.
So education is key.
Early intervention, promoting healthy lifestyles.
Empowering people to take control of their own health.
Exactly. And that, in turn, can help ease the burden on the healthcare system.
Okay, so we've got this mix of public and private healthcare,
Right.
with the government trying to level the playing field.
Trying to create some balance.
But we're still facing these huge challenges.
The rural-urban gap, lack of doctors, infrastructure issues.
And this heavy disease burden.
That's a lot.
So where do we go from here?
What are the solutions?
What's the game plan for the future of healthcare in Andhra Pradesh? So we've talked about the government's role, but the stuff you said also mentioned this, like booming private healthcare sector in Andhra Pradesh.
It's pretty remarkable, actually.
So what's the story there?
Well, think about those bigger cities like Visakhapatnam,
Uh-huh.
Vijayawada, even Guntur.
Yeah.
You've got these big hospital chains setting up shop,
Okay.
Apollo, Kim's.
Yeah, I've heard of those.
Even Narayana and Manipal hospitals. They're attracting top doctors, investing in, the latest tech.
It sounds like they're catering to a whole different crowd than those rural clinics we talked about.
Mhm.
Is this where, medical tourism comes in?
Absolutely. People are traveling from all over India,
Wow.
even other countries,
Seriously.
for specialized treatments, things they can't get at home or things that are...
Way more expensive elsewhere.
Exactly. And it's actually become a big part of the state's economy.
So it's like two parallel healthcare systems running side by side.
Kinda, yeah.
But are they totally separate, or is there, any interaction between the two?
That's where these public-private partnerships, or PPPs, come in.
PPPs.
The government's actually getting pretty creative in how they leverage the private sector.
Okay, I got to be honest. I'm having trouble picturing how that would work. Can you give me an example?
Sure. Let's say you have a government hospital in a rural area.
Okay.
They don't have an MRI machine.
Happens all the time.
Right. So they can partner with a private lab in the city,
Uh-huh.
and through Aarogyasri, those patients can get their scans at a discounted rate.
Subsidized by the government.
Exactly. It's a win-win.
That makes a lot of sense. So it's not just about competition between the public and private sectors.
It's about collaboration.
Finding ways to make the whole system work better.
Exactly. And there are even some PPPs focused on telemedicine,
Bringing specialists to remote areas.
through video conferencing, things like that,
It's like taking the best of both worlds.
and combining them.
It sounds like they're really trying everything they can, throwing everything they've got at the problem.
Yeah.
But with all the challenges we talked about, what's the long-term outlook? Like, is Andhra Pradesh actually on the right track with all this?
It's hard to say for sure. I mean, healthcare is so complex, right?
So many factors.
But there's a lot of potential here, and a lot of experts are suggesting things like, well, incentivizing private hospitals to open up in rural areas.
How would they do that?
Tax breaks, subsidies for building costs, things like that.
That could really change things, right?
Yeah.
Suddenly you've got specialists available to...
To a whole new population.
And what about those mobile clinics? Remember we talked about those?
Oh, yeah.
What if they were equipped with, like, telemedicine tech?
It'd be like roving hubs of specialized care reaching even the most isolated areas.
It's like bringing the hospital to the patients.
Instead of the other way around.
Yeah.
And then there's this whole AI and data thing.
Right. Everyone's talking about AI these days. But how would that even work in a place like Andhra Pradesh?
Think about it this way. You could use AI to analyze disease patterns,
Okay.
weather data, even population movements.
To, like, predict outbreaks.
Exactly. Get resources in place before things spiral out of control.
So it's not just about reacting to emergencies. It's about being proactive.
And with Andhra Pradesh facing those specific challenges, like the high rate of kidney disease in Udinam,
Yeah.
AI could help identify those environmental factors, target interventions where they're needed most.
This is really making me rethink how I see the whole healthcare system. It's not just doctors and hospitals. It's
data, it's technology, it's even social change.
exactly.
It's about looking at the whole picture, and that's what's so exciting about what Andhra Pradesh is doing, right?
They're not afraid to try new things.
They're willing to experiment, and that's where real innovation comes from.
So for our listeners, for someone trying to make sense of all this, what's the big takeaway?
I think the key is this. There's no one-size-fits-all solution in healthcare.
Makes sense.
It's about tailoring solutions to specific needs, leveraging both public and private resources, using technology to bridge those gaps.
It's a complex puzzle.
But they're putting the pieces together in a way that could be a model for other places facing these same challenges.
It's definitely given me a lot to think about. And who knows, maybe some of our listeners will be inspired to become part of the solution.
Yeah.
Whether it's through healthcare, policy, even just raising awareness.
What stood out to you from this deep dive? What sparked your curiosity?
That's where the real learning begins.
So keep exploring, keep questioning, keep diving deeper into the issues that matter most.